and welcome to Olsem Wanem. At some point in our life, we feel angry, depressed and anxious or live with fear that it affects the way we react to certain situations. Many people suffer from mental health problems, but how often do we take mental health seriously? There's a saying that goes, mind matters. There is no health without mental health.
According to the 2004 World Mental Health Survey, it can be estimated that 13% of a country's adult population will experience a mental disorder over their lifetime, of which 10% will experience a moderate to mild form of mental illness and 3% will have a serious mental illness. When these percentages are applied to Papua New Guinea's current adult population over the age of 15, we can estimate that over 500,000 adults will experience a mental health disorder during their lifetime, and over 100,000 adults will experience a severe form of mental illness. Mental health and mental illness are not the same thing.
What is mental health is all about how you feel about yourself, how you feel about another person, how you feel or cope with the day-to-day life. Suppose you feel good about yourself and good about another person. Now you can cope with the day-to-day life. Now you stop good blah, ting blah, you stop now. It's good mental health. But if you don't feel good about yourself, that's a simple way of saying. If you don't feel good about yourself and if you don't feel good about another person very often and you find him hard to walk in day-to-day life, and we get some kind issues or problems. We are not talking about a major mental illness, but there is an issue. The illness of the mind, we look at it as two ways. That is, one is neurosis, the other one is psychosis. So neurosis is the minor mental illness. That means all of us go through that issue. That doesn't matter whether I'm a psychiatrist or not. We all are human beings. So the most important thing is depression, because the global burden of diseases, it shows the leading cause of disability. That means I'm not talking about no gut leg or one kind problem you may get no gut, is the productivity goes down. So by 2020, the leading cause of disability is depression. So depression is part of the minor mental health problem, and you know that you can't really show out unless we ourselves identify we got an issue.
Mental illness is not caused by a specific aspect, but is multifactorial, meaning so many aspects combined can cause mental illness.
There are many causes. It's called multifactorial. There is no single cause can say it's causing mental illness. So if I want, I can say 5 of them. 1 is genetic. Number 2, Olsem, constitutional factor. When you talk about constitutional factor, when you break down, here the person structure and the personality matters. Because onset lo sikya step lo personality lo you Wanem kind personality, you harmonious or extrovert, you talk about it, you share problems, are you that type? Or some people keep things within themselves, introvert, or keep him inside low, or not share him too much. Number 3 factor is the physical factor. When you talk about physical factor, anything which touches the body. That means you can come from heart diseases like myocardial infarct, like heart attack, or anything which touches the kidney failure, liver failure, blood problem, hormonal problem, sexual disease like HIV, AIDS, or syphilis, or kind issues sexual side, subdural hematoma like Olsem domestic violence, all fighting head and about, and blood it can go inside. So you will see that anything which touches the head, the brain, and any part of the body. So when you say mental health, it goes hand in hand with the physical. So you can't separate. It's whatever goes on in your mind, it has got an effect on your body. Whatever goes on in your body has got an effect on your mind. So we need to keep on checking that. So that's physical factors. Number 4 is psychosocial factors. That's amazing because like financial issues, marital breakdown, like divorce, nabout, and others social issues, whether it's finance or loss of the loved ones, and kain wanem belat sampla kain birua come up lo heavy or wanem kain problem lo work or school or kain can influence that, and also different age group. Especially women who are pregnant after giving birth, during pregnancy, it is like people in the group of prison and adolescents, children, old age. So that's what we call psychosocial issues. Finally, well, everybody should know drug and alcohol has got direct effect.
Welcome back. We all experience moments of sadness, anxiety, and moodiness at times, and it is quite normal for a human being to do so. However, it becomes a serious problem when it interferes with a person's ability to function well physically and socially. The question is, what are the signs and symptoms of mental disorder?
Major mental illness is something, sometimes you can come with organic cause, that means any physical illnesses can cause this issue, or maybe not. That's what very important when somebody has got mental illness. It's very important to take it to a doctor to actually find out what's wrong, because it can be caused by organic. Organic means any kind of physical sickness. We'll talk about the causes, but any physical illness which can come with the onset of some kind of mental illness. So that is organic side. Narapla Olsem, you really don't know what is the cause, but you have a major, is called functional psychosis. That's where we could talk about schizophrenia and manic depressive, the two separate. So what is schizophrenia? It's all about thought disorder. Kind sick and brown law thinking blow man na come up lo behavior issues come in. So thought is called thought disorder, that is schizophrenia. Manic depressive psychosis is called mood disorder. So mainly come up also mood. So what happens in psychosis itself? You by looking also, it's a serious mental illness. You really need sometimes admissions. You will see it can be caused either organic or it can be other factors. But what happens is the person will have hearing, that means auditory hallucination, hearing voices where there is no real person. By harim toklo man or plenty old man talk or this la kind thing. Some time man by sit down na man or Mary by sit down na talk long yet. Another thing, false fixed belief, that means it's called delusions. People think that, oh, somebody is following me to kill me or poisoning kai below me. And their behavior may not fit. So the false fixed belief does not fit into the culture where this person comes from. Man or Mary who get sick, straight law psychosis, they don't know they are sick. Or by talk, hey, me no sick man or Mary.
In Papua New Guinea, stigma and discrimination is so strong that people hesitate to seek professional help on mental health or illness.
The factor is the stigma. People don't understand the disease or the illness, so they treat them as nobody. They think that, okay, he's a psycho already, send him to Laloki. So, psychologically, they think, oh, they are saying that I'm a psycho, so I need to, behave that way. So, yeah, one of them is the stigma. People really don't know what is mental illness, you know. So as our job here, when we take them out to the community, we advise them that, look, this person is like this, you know, it's going to be fit into the community. That's why psychosocial rehab is one of the vital component of that care that we have to do. We do family therapy, like we go and ask them, sit with the family and tell them that, okay, look, this person is like this, and it's going to behave this way, you know. So yeah, stigma is one of them. Best people are not aware of the illness. So we need to educate the people about mental health.
I think if people are well informed that, you know, mental illness is a disease and it's not due to, you know, like some kind of taboo or some kind of, you know, curse or something like that. It's an illness, it's treatable, and that any of us can be affected.
The Laloki Psychiatric Hospital outside Port Moresby City is the only long-term mental hospital in the country. Over the years, the hospitals had issues with infrastructure, overcrowding of patients, issues with water and staff accommodation. We hear more from the hospital staff.
The hospital is a National Psychiatric Referral Hospital. It was opened in 1967. So this year would be the 50th anniversary. So it first started as a mental health center. It's catered for mainly adult general psychiatric patients and forensic patients till year 2000 when a CEO was appointed. And so that was when it assumed the role of a hospital. Prior to that, it was still a mental health center. The staff number was quite limited. So since 2000, there's been a lot of recruitment taking place. A lot of new services have evolved here. So currently we are providing a model of care based on the biopsychosocial model of care, which addresses patients' physical needs, psychological as well as the social needs.
According to a survey carried out by the World Health Organization, the Now Hospital was initially established as a mental health center in 1967 to cater for 100 patients. However, the patient numbers have increased over the years, and you can imagine the challenges that come with it.
We've had issues with patients or people who've been convicted and sentenced here. Those are the ones that, you know, put us in a very tricky situation because on conviction form that, you know, these magistrates or judges fill out, they mention Laloki as a place for them to serve the term. And once they recover, we are caught in a catch-22 situation where we can't discharge them, even though they've already recovered mentally. We can't discharge them because of the court order, the court document. Because if we discharge them out, then there will be contempt of court. It's really hard getting those magistrates to revise those court documents. And so there are patients who've been here for 2-3 years, sometimes like just staying here without being mentally ill. Some recover like within months, but then because of the sentencing, they've been sentenced for 2 years. They have to serve the term here. We can't send them elsewhere, not to Bomana, because they were initially sentenced here. So we're currently working with somebody in the CIS who is helping us out, trying to sort those issues out by obtaining those documents and calling up magistrate to rectify or amend the documents, the court documents, so that Patients don't spend lengthy period of time here, but the rest of the time should be served in a prison.
The patient population at the hospital is mixed with forensic and non-forensic patients. Forensic patients are people who have been charged for committing a crime and sentenced to serve time in prison, but due to their mental state, they have been ordered by court to go to Laloki Hospital until they get better.
My name is Sister Renagi Moliela. I've been working here for the last 25 years, and I work as a director nursing for the hospital. I'm responsible for nurses and the patient care services for Laloki Psychiatric Hospital. The increased number of patients and the less number of nursing manpower on the wards, especially on each 3 shifts, we face a lot of difficulties in managing the patients. Because, for instance, when I'm referring to shortage of manpower, means the majority of the patients that are admitted are male population, and we only have one mental health nurse to look after even 60 patients in the acute ward, or one male mental health nurse to take care of more than 12 patients in the moderate care ward.
My name is Kuso Paru. I'm the Director of Corporate Services here at the hospital. I've been here for the last 15 years. So since my employment here at the hospital, I would say the challenge of working here at Laloki Psychiatric Hospital mainly is the infrastructure. Most of the ward facilities here are really run down. The trend of the disease or mental health is really increasing, the demand is increasing. So the facilities here, we cannot cater for the increase of patients here. So we also need to provide staff housing as well. That has been one of the big challenges as well, because most of our staff currently are living outside of in the city. And we cannot provide, effective 24 hours care to the patients. So that has been a big challenge for us, especially in terms of the infrastructure here.
We bridge the patients from the ward, inpatients, and then into the community. So what we basically do is we bring the patients up, recommended by the psychiatrist, and we take them out for activities like sports, cooking, gardening, showing for females, even males too. And we do counseling as well. We also have drug and alcohol officer she does the counseling part of drug and alcohol part of it. But as for us, we just do the counseling. We counsel them how to look after themselves when they go back into the community, how to adapt to themselves, with the family, and with themselves.
To conclude this week's Olsem Wanem program, we discussed the management of mental health and the need for more people to be trained in this field.
For mental health issues, it is important to investigate and identify the mental disorders to find out the exact cause. By doing this, patients can receive the right treatment from the mental health services available in the country.
So how do we manage it? One, this is called physical management. That means we give medications because the onset of mental illness can have chemical imbalances. So we need medications. Okay, that is one way of managing the patient. Number two is to call occupational therapy, because at the time when somebody is having mental health issues, they lose some of their skills. So they need to bring them back to the reality. That's called like working on the occupation, so occupational therapy. And also the rehabilitation is another one. And also talking therapy, counseling, and also psychotherapy. It's a specialized area, but in simple term I can take listening to them, talking to them, reassure them. Those are simple way. But we have a psychotherapy where we take the patients, take an hour. Yes. So dealing mentally ill patients or mental health patients, not 1 minute, 2 minutes, it takes an hour, minimum an hour to get to know the person, and especially to know why this person is sick this way at this point of time. So we need to find out. So you will see rehab is the process actually helping people to find ways to return to the normal life. So rehabilitation is important. So I'm sure physical treatment with the medications appropriate, and rehabilitation, occupational therapy, psychotherapy. These are important, and when we treat the patients, there is a psychiatrist or will be there. Psych nurses is a teamwork basically. Psych nurses, social worker, psychologist, and pharmacist. We all have to meet together to bring a person where he has gone downhill, to bring him back to normal, probably to fine-tune the person to be more better.
I think the most important thing is people must realize that there are services available now. Like for instance, in Port Moresby, we got several places you can go to. Like you can go to Port Moresby General Hospital and be seen there. You can also go to urban clinics. We now have mental health nurses who are trained, who are actually working in urban clinics. Some of the urban clinics, not all, but some. So those mental health nurses might be able to attend to you. If the case is serious, they might refer you to Port Moresby General Hospital.
There is a need for mental health specialists in the country. The University of Papua New Guinea offers programs specialized in mental health, and this is a bonus for Papua New Guinea.
In the Pacific, apart from the Royal College of Australia, we're just proud to say that our University of Papua New Guinea has got training psychiatrists. That's how me as a Papua New Guinean citizen was able to do my postgraduate. So we are proud, and even at the world level, in the Pacific, we should be proud that we have got a master's in training in psychiatry to become a psychiatrist, so the doctors can become a psychiatrist. The same way, the nurses also, we actually train nurses from throughout the Pacific Islands. So we also have it's a degree course on mental health nursing.
However, despite the availability of these programs on our home soil, more Papua New Guineans are encouraged to take up these programs to help the mental health sector of our country, as we continue to see the training for healthcare staff for mental health disorders is an ongoing challenge in PNG.
We need more people. Like mental health or psychosocial team is a multidisciplinary. There is a psychiatrist, a clinical psychologist, a rehabilitation officer, a mental health nurse, a social worker, a drug and alcohol officer. We all play a part in a patient. And I advise, we need more mental health nurses. We need more people to go and do their study, come back and try to improve the mental health services of Papua New Guinea. Because most of them, they don't know what is mental health. So as mental health nurses, we need to promote our profession and tell people that, look, there's a hospital, there's people there, you need to seek help from there. We cannot just leave people roaming in the street. Because other overseas people come and they see people roaming, they said, "What? My goodness, what is this?" We have a hospital here. And what I want to see in the future is we need to have a big psychosocial rehab center where there's a kitchen, there is a bed, where we can teach the patient to make his bed. When he gets up, what will he do? Just leave the bed and go? No, he has to make a bed,
That's all we have for this week's episode. If you have any comments or stories you would like to share, please send us an email via the address showing on your screen or visit our Olsem Wanem Facebook page. From the Olsem Wanem team, it's goodbye for now.